Hi, I'm Dr. Lane Smith, and I'd like to talk to you about fat transfer to the buttocks, otherwise known as Brazilian butt lift. While feminine beauty has always been associated with a curvy and a beautiful shape, this has been more important than ever in today's popular culture. Today, many of our icons are known especially for their curvy figures and their narrow waists. The shape of a woman and how curvy it is related mostly to genetics. Patients think that if they gain weight, they'll get curvier, or if they do certain exercises, they will get curvier. This is actually not true. The main thing that determines a woman's shape is actually her genetic makeup. What happens is the fat cells that you have simply expand if you gain weight, and they contract if you lose weight. Therefore, whether a patient is curvy or apple-shaped or straight or pear-shaped is determined mainly by genetics and the distribution of the fat cells that they have. Fat transfer to the buttocks, or Brazilian butt lift, works by taking fat from areas where you don't want them and placing them in areas where you do want them. Remember, genetically you can't move the fat cells around. If you have all your fat cells sitting in your waist and none in your hips, no matter what you do, that won't change. But if we take the fat cells from your waist and place them in your hips and buttocks, now forever you will have more fat cells in your hips and buttocks and less in your waist. What this means is right now, say for example, your problem area is your waist. You gain a lot of fat in your waist, you have big love handles. No matter what you do, you really can't make those go away. You starve yourself, you go on diets, and every other place gets thin, but your waist remains big. Your love handles remain large. This is because genetically that's where you put all your fat cells. Now if I go in and surgically remove those fat cells from your problem area, your waist, and place them in your hips and buttocks, it's the exact opposite. In the future, instead of your waist being the problem area, the waist will be your good area. It will be hard to gain weight in your waist because your waist has all the fat cells removed from it. And it will be easy to gain weight in your buttocks and hips because I placed all the fat cells there. So one of the advantages of a Brazilian butt lift is we take fat from the unwanted areas and place them into the wanted areas, and this is a permanent change. So in the past, whenever you gained weight, it went to all the places you didn't want it to go. Now in the future, after surgery, when you gain weight, it will be hard to gain it in the unwanted places and easy to gain it in the wanted places, your hips and buttocks. The largest portion of the Brazilian butt lift or fat transfer is liposuction. When we do liposuction, we take fat from the problem areas. Usually this is the waist, the back, and the abdomen. While we usually take fat from the abdomen, the waist, and the back, we can take fat from almost any area of the body. This means we can use the arms or the inner thighs or the area under the chin and place that fat in the buttocks and hips as well. Patients often ask me, how much fat are you going to place in my buttock and hips? The answer is determined mainly by the patient's desires, how much fat she has, and how tight her skin is. Patients think that we can just place an unlimited amount of fat into the buttocks. The truth is that we are limited by the tightness of the skin. As we inject fat into the buttocks, the skin gets tighter and tighter. Eventually the skin will get so tight that no more fat will fit in, and it simply squirts right back out the hole. This is when we have to stop. So it is a misconception that patients can simply gain as much fat as they want and we can put all of this fat into the buttocks. Well, I try to put as much fat as I can in the buttocks and put as much as I can until the skin gets so tight that the fat begins to squirt back out. The hips are a different thing. Different patients like different things. Some patients want me to put a lot of fat in the hips. Other patients want me to put just a little bit of fat in the hips. One of the things that limits us is how fat the patient is. We don't want the patients to be too fat, but we also don't want the patients to be too thin. In general, if your body mass index is less than 24, we would like the patient to gain some weight. If your body mass index is really high, let's say over 30, we typically like the patient to lose a little weight, or we may need to do an additional procedure like a tummy tuck. The reason we cannot simply do liposuction until a patient is thin is because we are limited on how much fat we can safely take out. In general, at any one time, we can only safely remove approximately 5 liters of fat. Often patients come to us for a Brazilian butt lift after having children. If the patient doesn't have a lot of stretched out skin from her pregnancy, then she will be a good candidate for a Brazilian butt lift. But if the pregnancy has left the woman with a lot of hanging and loose skin, then often we will need to consider doing an abdominoplasty as well as a Brazilian butt lift. If you've had children, when I do my physical exam, I'll let you know if just a Brazilian butt lift will be good enough for you or if we need to consider also doing a tummy tuck. When we are doing a Brazilian butt lift, we don't need to make a lot of scars. We actually only need tiny little poke holes through which we place our liposuction cannulas and through which we can inject the fat. In general, the tiny little poke holes are well hidden. We typically place some inside of the belly button, inside of the little butt crack, and in other areas where they are generally well hidden. As I mentioned, when we place fat in the buttocks, we try to put as much as we can. But as I also mentioned, the skin tightness limits how much fat we can place in the buttocks, but we always try to put as much as we can. After the fat has been placed into the buttocks, only approximately 60 to 70% of the fat lives. About 30 to 40% of the fat dies. Initially, after the fat has been injected into the buttocks, the fat is very fragile. Therefore, it is important for the patient to protect the injected areas. This means that the patient needs to stay off his or her buttocks for about 3 to 5 weeks after surgery. The recovery from the surgery is not very difficult or painful. However, it is quite a nuisance to stay off the buttocks for 3 to 5 weeks. This means that the patient needs to sleep on his or her belly for about 3 to 5 weeks and to try to avoid sitting on the buttocks. Staying off the buttocks is an important part of a Brazilian butt lift, and we'll go over different ways to do that in our consultation. Patients can return to work as soon as 7 to 10 days after surgery, but whatever you do at work, you need to do it standing. For example, if you have a desk-type job, you need to stand behind your desk. If you work already standing, like a cocktail waitress or some other profession, then perfect. But whatever you do, you need to do it standing for about 3 to 5 weeks. After about 3 to 5 weeks, the fat has grown safely into place, and it is no longer critical for the patient to avoid sitting on the buttocks. Patients often ask me, what happens if I have fat transfer to the buttocks and then I lose a lot of weight? Will that ruin the surgery? The answer to this is no. Remember that curviness is not determined by being fat or not being fat, but by where the fat cells sit on your body. Once we have moved the fat from your problem areas, for example, your waist, abdomen, and back, or wherever else you want it, forever there will be more fat cells in your buttock and hips and less in the problem areas. This means that after surgery, you will always be curvier. Remember that curviness is not determined by how fat you are, but by where the fat cells sit. Therefore, after surgery, if you gain weight, it will preferentially go to your buttocks and hips, and it will be hard to go to your abdomen, waist, and back, and any other areas that we did liposuction on. If you happen to lose weight, it'll be easy to lose weight in your problem areas, your waist, your back, your abdomen, and hard to lose it in your buttocks and hips. This means that after surgery, it will be the exact opposite of what you were prior to surgery. Prior to surgery, if you gained weight, it went to all the places you didn't want it to go. After surgery, if you gain weight, it will be hard to go to those problem areas, and instead it will go to where you want it to go, which would be your buttocks and hips. Brazilian butt lifts take about 3 hours to perform. We usually do the surgery under general anesthesia. This means that we put you all the way to sleep, perform the entire surgery, and then wake you up. In general, the surgery is very safe when it is properly performed by well-trained surgeons who have a lot of experience in this area. When the surgeon is not properly trained or does not have a lot of experience, it can be one of the most dangerous surgeries in plastic surgery. Fortunately, I am one of the most experienced surgeons in the United States for Brazilian butt lifts. I have been doing these since approximately 2004. Most of my colleagues did not start doing them until around 2012, 2013, and 2014. I have done among the most in the entire United States, and my record of safety is extremely good. During our consultation, I will go over the risks of Brazilian butt lift surgery, and our staff will also review them with you. Brazilian butt lift is one of the most common and one of the most rewarding surgeries I perform. Patients love the results. I encourage you to look at our before and after pictures at smithsurgery.com and compare them with anyone in the United States. I think you will find in general that our results are more impressive and that I have done more cases than almost any surgeon.